I'm very fortunate in ophthalmology that we have the skill set and the technology that we can actually help patients and perhaps get them to see better than they've ever seen in their entire life. And that's really different in medicine. Every step of the way in school was an absolute blast for me, through undergrad and through medical school. When I did a rotation in ophthalmology in my end of my third year of medical school, that was it. I just put the blinders on and I said, I'm going for it. I went to the NIH in Washington, D.C., and I spent 2 years at the Eye Institute there doing benchtop research and clinical research. And then went back to Henry Ford Hospital in Detroit, and I did my ophthalmology residency. What makes Revision different than other eye care providers? It starts with our staff and the education and the selection of the staff. There's also the education and training of the surgeons and doctors on the Revision team that separates us. We're fellowship trained cornea specialists. We do cataract and laser vision correction. Whenever I'm meeting an individual who's interested in vision correction, the most important question I ask them is, what do you do? What is your passion? What are your hobbies? What's your work environment like? Because when I go to recommend a treatment plan for an individual, what drives those decisions is the individual. And then actually helping them through that surgical process and wowing them on the other end, that is a buzz for me. And so that's a big part of what separates our practice from others. So I have 3 children, and they're all my passion. My dad was a hero of mine. So my dad flew a B-24 bomber in World War II, and he flew 30 missions. I had a passion for flying when I was young, but I didn't learn how to fly until I was 49. My wife and I did it together. She got in the plane and she flew it. She said, that's the coolest thing I've ever done. I want to do this. We've been able to give back in this organization. And one of the things that we've done is, for the last 5 years, we've traveled to Jamaica and we've done surgery for patients that can't get access to the surgical care that we can deliver. It changes you. When we come back, we realize how good we have it here. It's unusual when I meet a patient I cannot help. So helping people is cool. You know, it's just very cool to be able to do that.